Thank you so much for joining us this afternoon. We are excited in this workshop, we're actually going to do some work. And so even throughout the time together, we're going to ask, and if I'm too loud, I'll lower this. Throughout our time, we're going to ask that if you, when prompted, we'll ask to get in either groups or 2 or 3 to kind of process some questions that we have so that you can reflect on your own managers, on your own culture within your organization as well. We'll go ahead and introduce ourselves. We are Cultured Enough. We are an organization that works with small to medium-sized nonprofit organizations, and we kind of have a niche for working with faith-based organizations, especially in the realm of equity, in the realm of development of the different layers within your organization. We understand that every org has a different mission, and it is anchored in what they believe to be the feet and hands of Jesus in that community. And so we help organizations to be able to utilize their mission, vision, and values and help reflect the work that God wants to do in that community. And how do you use that with the technical skills of really developing the different layers of your organization? And I want to preface this by saying there's going to be different sizes of the organization in this room. There's going to be different funding. There's going to be different structure. So we don't want to exclude anyone. We want anyone that is everything from a federally funded to also free and charitable organizations, so that no one feels exempt from this work as well. And our interest is really looking at the development of managers. We work across the country with nonprofits, faith-based organizations, as well as health clinics across the country to be able to kind of assist and walk alongside them in their journey of fulfilling their mission within their cultures and within their community as well. And so we work with different organizations. We just came from Waco, Texas, working with Dr. Griggs, who's a phenomenal leader at Waco Family Medicine, and also working closely with Esperanza Health Center and Susan Post, and the work that they're doing there as well. And so really understanding that within the healthcare sector, we know the priority is always going to be patient care quality. We know that the mission is to be able to provide that support for the patients within your community. However, we want to have you think layer deeper into the staff experience and how that also impacts patient care quality and how it's a direct correlation as well. This is our team that's spread out throughout the country. We have people in Seattle with Junelle, and then Toronto as well as Philadelphia. And our founder, J.L. Chambers, he's been spoken at this conference several times, and he is now the executive vice president at Lancaster Bible College. And the vision that he had was really to be able to assess small to medium-sized organizations at an affordable rate to make sure that they also get the quality assessment and quality development that every other organization deserves to have as well, because we believe in your missions. We believe that you should be able to be the hands and feet of Jesus within your communities. And so how do we assess every layer of the organization so that it is equitable across the board as well? A little bit about my work is that I've done organizational change management. Was intrigued by studying it just because my background really is in nonprofit management. I've been in the behavioral health sector as well as ministry. And so all separate silos, but what I found were the common themes was culture. Culture can help enhance your experience, whether it's in ministry or nonprofit or where you're called, or it can actually be a bottleneck to where you're serving. And specifically, I am passionate about this, and I would desire to see equity in every organization, especially it's supposed to represent Jesus Christ, because I've been in ministry and I've been there, and as the only woman of color, for example, in different settings, I have seen and witnessed a bottleneck that I have faced. Even when that tension between, wow, Lord, I am actually called here, I know I'm called to these youth, or I know I'm called to this ministry, but the structure and the culture in which I am trying to do it is not allowing me to be my fullest in that place. And so really looking at what are the staff experiences that you have heard lately within your own clinic? What are the bottlenecks that maybe your managers are facing in regards to managing cross-culturally? And so what we do is we really take research and data, we take life experiences, and we take anecdotal notes to be able to say that there's something here, and really wanting to be able to address it so that we can all fulfill the mission of what God has called us to do as well.
Hello, and is this on? Oh,
Yep.
yeah, it is. All right. Hello, everyone. My name is Junelle Marinas, and I am also part of the Cultured Enough team. A little bit about myself. I don't know if y'all know the stereotype about Filipino nurses. The safe space? All right. So my mother is a Filipino nurse. My brother is a Filipino nurse. My sister is a Filipino nurse, and I am an expert karaoke singer. No, I'm playing. I'm the associate director of our EdEnough e-learning platform. And so really what I get to do for our organization is to help the C-suite directors, the managers, task force members as well to create professional development plans for their organization. So no matter if you are seasoned with 15, 20 years of experience with patients or in the community, or if you are a manager stepping into a leadership role for the very first time, or if you are a director, for example, that is leading in cultural change, we create custom learning pathways for your specific role as well. And some of the outcomes that we've gotten to see from the 16 organizations that I've personally worked with on our EdEnough platform is just shared language in general about the topics that we're talking about, shared expectations. There's also been a decrease in fear around learning and also talking about mistakes that have been made. And there's also an increase in engagement as well as curiosity as well. And so now that you've gotten to know a little bit about us, we also want to pass the mic to you all, not physically, but if you could turn to 1 to 2 other people next to you, right? This is a workshop, Alyssa. We're working today.
We're working.
If you could ask these questions, if you don't already know, what's your name? What city are you based out of? And then if you could describe your organizational culture in 3 words. And then one last thing I want to ask of you in this group discussion that you'll have 3-4 minutes for is if you could rank the following elements in terms of importance, being patient care quality, professional development, and staff retention. So if y'all could go ahead, turn to people next to you, and get to work.
I want to go into this really quickly, a posture of our time together, just because I feel like when we're having very candid conversations about the clinics that we work in, what I ask is for a posture of listening and understanding, knowing that we'll all have different experiences, and you all maybe have different experiences even in the same organization. When you talk about power dynamics, gender dynamics, cultural dynamics, there's so many things that can give us different experiences in the same org. Disagreement is normal, so we would ask that even if you have a very opposing view, that you still share it out of respect, because I think it's good for us to learn from how people are dealing with different bottlenecks within the organization. Everyone is welcome to participate, and I statements go a long way. So not really speaking for someone, but saying the I statement that speaks to your experience as well. And to being able to see that when we do have, so with that said, I want to be safe space here. How many people are being developed currently or have seen professional development of their leadership currently right now? 1, 2, 3, 4, 5, 6, 7, 8. Okay, 8 people. And so this is where we want to get creative with you all to say that regardless if you are federal funded or free and charitable, how can we get creative to say that there is a development of managers that need to be had? And I want to say that a lot of the times in the ministry context, in my background, I have done ministry, especially in the youth aspect, and I come from 3 generations of pastors and ministers and church planting in the Philadelphia area. When we talk about ministry, we know that we are called somewhere. However, we also have the responsibility to also develop and be developed as well. And so really wanting to say that there's resources available to make that happen, to tie the gap at the same time. This is just to say that we're going to give you resources, we're going to give you competencies, but don't sue us if it doesn't work. So really saying that we want to give you in your hand resources that meet you where you're at, as well as have very candid conversations so we could at least start the conversation in your clinics or in your leadership spaces to say that how can we get started in this work, if anything. We're going to define organizational culture for you. I think definitions is great so that we're all on the same page of what organizational culture means and examples of it. And I want to say that in our line of work, we are equity experts, and so we understand that there's a marriage when you talk about a cultural, ethnic culture, as well as a work organizational culture. And knowing that I'm assuming because you are in communities that are uninsured and underinsured, that you probably have diversity somewhere in your vicinity, whether it's the patients you serve, your frontline staff, or your leadership managerial level. There's diversity, I'm gonna make that assumption. And whether that's diversity of socioeconomic, gender, or race and ethnicity. With that said, understanding that what we desire and what we believe healthy culture is that no matter those backgrounds, you can bring your cultural, your ethnic culture, your socioeconomic culture, how you communicate that way to the workplace, and it still be utilized and represented and cultivated as well. Very rarely do we ask people what their cultural background is in communication, in how they process information, and how they make decisions. And so we are assuming that if you're gonna come work for us, you're obviously gonna work for the dominant culture and what we do around here. So really looking at organizational culture and defining it so that we can have a framework and talk within those lens. Managers' impact on the organizational culture is gonna be key for you all to listen in, and then essential skills and competencies, which we can all grow in together. So skills and competencies, there's hope, because we're saying that there's resources to grow in. It's not that we have arrived yet, but with resources and investing in ourselves as professionals, but also providing resources for our higher ups, even provides an opportunity for skills and competencies as well.
Awesome. So let's start here. What is organizational culture? Organizational culture is oftentimes seen as the personality of a workplace, right? Something that you can really feel, it's tangible. And what we want to be able to emphasize for you here today is that organizational culture, a focus on organizational culture, is really going to be able to be a tool for your managers and leaders. And we're going to be able to also highlight some of the more tangible effects of organizational culture, such as values, beliefs, assumptions, and behaviors, because those areas, those elements are going to influence areas such as patient care quality, attitude around learning, as well as staff retention. So here's an example of a value that can influence organizational culture. And I pulled this from one of our partners, Siloam Health. Anyone in Siloam Health in here?
Hey, shout out.
Hey. So I pulled this from the website of Siloam Health because I just really love this example of the value around creating sanctuary. And the reason why I really love this example is because it's also described. It's not left up on interpretation. It's described for you so that people are not lost. There's a standard there for creating sanctuary in patient care as well as in team dynamics. And this is really a tool for managers because managers can see this value, and when they see it in a staff member, either in patient care interactions or with another colleague, they can celebrate and say, hey, I saw you creating sanctuary right here, and celebrate that. Because people like to be acknowledged, right? Who likes to be acknowledged? Anyone? Oh, just me? Oh. And at the same time, too, when a people manager also notices the absence of creating sanctuary in patient care or with a colleague, they can also go back to this value and say, hey, I noticed that there was an absence. Let's talk about it. Beliefs. Beliefs are also something that influences organizational culture. And because we are at CCHF, Christian Health Conference, right? I think we can be all on the same page here with the belief that everyone is a child of God, that Jesus is at the center of what we do, and that we are called to the organizations that we are working in. And these really serve as a compass for day-to-day interactions, day-to-day decision-making, as well as attitudes, too. Assumptions. So these are a little bit more tricky part of organizational culture because they're not really written anywhere. Assumptions really lie in the little hallway whispers, or sometimes it's just in your head because you don't even want to share it out loud. But when assumptions are positive, such as patients always come first, Teamwork is essential to providing quality care. All employees have a voice and their opinions matter, or I feel supported. I am supported by my manager. When those are positive, it can create a healthy work environment. But if those assumptions are negative, such as I don't have a voice and my opinions don't matter, or my home life doesn't matter to my supervisor, or I don't belong here, when they're negative and left unaddressed or unrecognized, they can really lead to burnout or people leaving the organization entirely. And as we were preparing for this presentation, I was talking to my friend who used to work in healthcare as a nurse, and she was talking about an assumption that they had among the nurses that once your body's burnt out, I feel useless. I don't feel valued at my organization anymore because I can't provide any physical labor. I feel like a workhorse in that way. And so that's one assumption that led her to honestly leaving the organization, that she really loved the work, but she could no longer be there for her own health. And what I want to talk about in organizational culture is that it's dynamic, that assumptions can vary greatly in the same organizations, because we've done hundreds of interviews of organizations and also collected thousands of responses from our assessments on organizational culture. And we found that among the same team, even if you have the same manager, those assumptions, those answers and perception of the organization, completely different. So it's dynamic, right? And so while a lot of people in general at the organization may have positive assumptions about their leadership team and how the organization sees them and values them, there may be individuals in your organization that don't feel that same way. And oftentimes, you're not going to be able to hear it because there's not a space for people to be able to communicate that, or they don't have a manager that they feel like they can trust to be able to communicate that. And just like Alyssa said earlier, in the organizations that we're working with, everyone may feel called, but if I don't feel like I belong, I don't know how long I'm going to be able to stay there. So I'd love to have y'all go back into the groups of people that you were in earlier and also process this amongst yourselves about your organizational culture. What are some beliefs or assumptions that you've observed at your workplace in the last month? And we'll give 5 minutes.
And so as we get into data, we want to look at the data, not just speaking from anecdotally or what we have seen in our own systems. But in 2019, the National Academies of Medicine actually brought this to our attention in terms of how burnout has been the worst that it has been. And 2019 was before the pandemic, okay? So let's not use the pandemic as an excuse any longer, but just say that there has been a notion of burnout in the healthcare system before the pandemic was a thing, and understanding that 54% of nurses and physicians and 60% of medical students and residents suffering from burnout. And so understanding that, yes, we want this to be a sanctuary and safe haven for our patients, but also the investment that needs to be done in the staff experience. What does that look like, especially when we are faith-based organizations and we're wanting to live out the mission internally as well as externally at the same time. And what we want to bring you to is, yes, that is probably overwhelming, but we want to point you to where it's impacting organizations specifically and how there's hope to be able to kind of mitigate some of this as well. I want to bring your attention to how burnout can have a negative consequence on health workers. There's insomnia, there's diabetes, isolation, substance abuse, anxiety, and depression. Relationship and interpersonal challenges that happen within the workplace. If you've ever faced the burnout season, you understand that it does get to that point. And exhaustion from overwhelming care and empathy. And so really understanding that we want to be able to pinpoint, and you can actually assess these aspects for your staff. That is what we do with organizations, is we help you create a climate survey, for example, that helps really measure what are the staff feeling on the ground level to get that data from a very honest perspective. How it also impacts patients, which we care a lot about, is less time with health workers, especially if there's a metric on you needing to meet a quota of patients per day. Or the time spent with patients. We get into this work to really want to invest and pour into and ask so many questions, especially about the determinants of health with the patients, but understanding that financially there's also quotas that need to be met per person, per hour, per day. So really holding that balance between what time is being spent with health workers, delay in care and diagnosis, lower quality of care. So if there's a rush or if there's a burnout system, I may not be giving the right treatment like I should be as well. And then therefore leads to medical errors. In terms of the system as a whole, we're looking at shortages, and I'm sure you all know retention challenges like my friend mentioned. So even with pay, the retention to keep healthcare workers is a result of burnout as well. And then the risk of malpractice and increased costs. It costs a lot to onboard and to hire. So being able to say that the cost and the retention equals the financial cost of onboarding and training all over again. So really understanding that if we can get this culture thing right, if we can invest a little bit more in our managers, who we'll get into in a minute, it kind of financially also cut costs on that aspect as well. And then what I want to bring you to is the impact of community. So when you have even frontline staff, for example, so those who are meeting for the first time, they're checking you in, even the frontline staff, even if they're going back to their homes and their families and they're telling them about your organization or your clinic, they're telling the community about your organization and your clinic. And if they are not having the best time, if they do not feel like the love of Jesus on that Wednesday during lunch break when someone said something that was inappropriate, it also erodes trust with the clinic, erodes branding, it erodes, is this clinic gonna fulfill the mission internally and externally as well? And then I'll just leave you with population of health outcomes, understanding that I've spoken with a lot of CEOs that are CCHF members in health clinics, and usually they are the only providers from miles out. And so how can you really be able to be the light in that community, even if you are the only serving as well? And where there's hope is, I want to say that there's a whole societal issue about the health system. There's a whole societal issue about the healthcare system in and of itself. But where I want to focus our eyes and where we can control is the organizational factors and the workplace factors. This is where we want to live for the next value of our time. And understanding that organizational factors come into lack of leadership support, like someone mentioned. I'm not even going to share with my manager what's going on at home because I already know and I already assume, based on patterns of behavior, that they're just going to note it down, and they're not going to even care or help me get more support in this area. So really having the lack of leadership support, disconnect between values and key decisions. So understanding that even if the mission is on the website and the values are on the billboard when I walk down to the water cooler, but the culture in and of it doesn't reflect those values, there begins to be a dissonance and disconnect with what I'm doing and how I'm living out the mission. Excessive workload and work hours, we know this. Bias and discriminatory structures and practices, those increase. We're already coming with bias. Everyone has bias. We're already coming with bias. But when there's a disconnect in organizational culture, that dissonance and that disconnect increases because you're not able to check those biases at the door. And then where we're going to go into now is really the workplace learning environment, and understanding that data speaks to also understanding that managers have a direct correlation with culture of collaboration and vulnerability. And so a lot of the times organizations do not talk about this aspect, and so that's where we're going to kind of give you resources so that if you are talking about it in your workplaces, resources to meet you where you're at, and if you're not talking about it yet, how do we start that conversation within your work environment? And then we're going to go into kind of managers' impact, as well as data that reflects where we know that the managers have a direct impact on culture, and being able to say that they have the power to increase it, because a lot of the C-suite and C-suite leaders and founders of the clinics, they have a vision for culture. However, if it is not communicated well, if it's not kind of also cultivated at another level, then it will just be a vision. It will not actually come to play.
So a manager's impact. And just to clarify, when we're talking about managers, you do not need to have the title manager as your position to be a people manager. If you are a senior nurse overlooking the junior nurses or your techs, or if you are a director overseeing other managers as well, then that's what we're referring to as people managers. And the approach that a manager has on the development and well-being of their staff does influence patient care, like we've been saying. And here's what the data says, that 70% of a team's engagement is influenced by a manager. 70%. Has anyone heard that phrase that people leave managers, not the organization? Anyone?
Yep.
Yeah. Research also says that managers impact employees' mental health more than their parents impact their mental health, more than their children impact their mental health. Any parents in the room? All right. I don't have any kids, but I have 5 siblings that all have kids, and blessings, all of them. But managers influence mental health more than the kids do, and managers influence mental health as much as a spouse does. That's a pretty crazy statistic. And I just want to be able to sit in this for a moment, because when healthcare professionals feel valued and supported, right? Let me step back. When managers are equipped to and developed to be able to make staff feel supported and valued, then that's when they're gonna have higher engagement rates and also a higher capacity to show up for their patients, to be aware and not just be doing airplane mode, right? Or autopilot mode, that's what I meant. And when healthcare professionals ignore those symptoms of burnout, like Alyssa was talking about earlier, we're gonna get more medical errors, we're gonna get delays in patient care, and we're gonna overall get a lower quality of care as well. So we're gonna get into essential skills and competencies, but before we do, I also wanna share a common theme that I've heard in the healthcare industry where people, I've seen so many nurses, providers, people in patient care that are excellent. They are so passionate. They take their time. And so they get promoted into managerial positions. And that's good. That's great. But oftentimes when they're getting promoted, they're not getting trained on how to retain staff. They're getting development and they're getting evaluated on patient care key performance indicators, right? How many patients are we getting in and out? What are the outcomes of patients? That's what managers are being trained for. But managers are the people, they're the middle ground, right? So regardless of if you are a 10-person organization, 50, 300, 3,000, managers are the ones that are the eyes and ears on the ground, and they're able to control that environment. And they're also the message relayers for people who are creating the values at the top. Unless they go through the manager, they're not going through, I'll be honest. And I also want to point out that being a healthy manager isn't magic. And what I mean by that is we're going to get into these skills and competencies. You might recognize some of these practices. And you might see and say, oh, that's called psychological safety. Oh, that's called emotional intelligence. And you'll see a lot of these practices already being done in your organization, and that's fantastic. But what we want to be able to do is help you create a framework for what a healthy manager is, what skills that they have, what competencies they have, because it's not magic. There's skills that we can be developed in and that we can recreate and we can create standards for so that it is going beyond the tenure that manager is there. So the first competency that we want to be able to talk about is psychological safety. Has anyone heard of psychological safety in this room? Okay, awesome. So psychological safety is defined by Dr. Amy Edmondson as having 4 components. So the first stage is really just the basic stage, inclusion safety. Do people feel valued at this organization? Then we get into learner safety. Do staff feel safe enough to ask questions and to learn at the organization? contributor safety. Do staff feel like they can share their opinions? And then we get to stage 4, challenger safety. And that's asking the question of, can staff voice their concerns without fear? And so at its essence, psychological safety enables a team to be able to voice those opinions, right? And to also ask judgment-free questions, because we're coming here as medical experts, right? But sometimes we just have questions, and that's okay. And also to be able to talk about mistakes that are happening in the organization and mistakes that we've prevented as well. I want to point out that most mistakes that happen in healthcare are very small. They are simple chart errors that we can go back and edit. They are small dosage mistakes that we can correct for, right? And these are mistakes that can oftentimes be overlooked if they're not being focused on. And if we're being honest, the bigger mistakes in healthcare, when we make a really big dosage mistake, for example, those are much more noticeable, and they're going to come out anyway. But I'm really talking about the small medical mistakes that we can be corrected for. And the thing about those small mistakes is that they can easily snowball if overlooked. And what I mean by snowball is it's going to keep growing and growing and growing and create bigger problems for the patients if they're not addressed. And so research also tells us that 250,000 deaths happen every single year in the United States due to medical errors. And so that's why psychological safety as a competency is so important in healthcare, because when a manager ingrains a culture of blame, then people are not going to speak up. It hinders people from being able to go make that correction really quickly. People are going to hesitate to speak up. But when a manager is skilled in psychological safety, when they are developed in psychological safety, then those corrections, a mistake's made, we can correct it real quick, and we can move on. And this is so crucial, because I know patient care outcomes is the most important thing that we're talking about here. It is crucial for patient care outcomes.
And one of the assets that I think we mentioned, especially in that corner of when we cannot compartmentalize. First, I want to ask, are there any questions that are being sparked right now in regards to skill sets or psychological safety? Any questions we want to be able to address? Was that all tracking the essence of psychological safety? Okay. And if you go back, Dr. Amy Edmondson coined the term in the medical field. And so she studied in the hospital experience of when there is a lack of psychological safety, people are afraid, especially with their power dynamic and working with a provider that is really dictating how they're supposed to work. And if she did studies on when nurses or clinicians are afraid to approach or to challenge the provider at hand making the decisions, that's where patients are impacted. And then moving to emotional intelligence with Travis Bradbury, this is coined by Daniel Goleman, actually, and understanding that these are competencies that can be measured of managers. And so I don't know if you've ever been in the workplace where you couldn't put your finger on it, but you worked for a manager that had very low emotional intelligence. Oh God. And you're like praying for your manager in your morning time with Jesus, because you are praying that they get it together, that they don't bring their baggage into the workplace, or that they are able to, Lord, do a work. And so being able to say that when you understand, you couldn't really put your finger on it, but what that is called is really having a manager that has a low emotional intelligence. And these are the kind of competencies that are broken down where a manager doesn't have self-awareness. They are not aware of the tone in which they speak to someone who is a non-English speaker. They're not aware of how, if you increase your volume, maybe they'll hear me better, or maybe the non-English speaker is trying to get treated and trying their best to speak English the best that they can. But if someone is not aware of their tone, of their posture and how they're speaking down to someone instead of sitting down and making eye contact and humanizing them on that level, everything from tone, body language, they are not aware of the presence that they bring when they walk into the room. That is a lack of self-awareness. An understanding that if a manager does not have self-management, they cannot compartmentalize. And as a manager, if you are a provider or a manager, you are hired the big bucks, whatever that may look like, to have the responsibility to manage people well. And so if you don't want to manage people, then maybe we need to get your solo practice and don't work with people. But if you want to manage people and also know that you can't do this work alone, no one is called to do this work alone. If we can't self-manage ourselves and self-regulate, we are going to vomit life on other people that don't deserve it. And so when you have managers that cannot compartmentalize, are bringing a disagreement from a previous meeting or a previous unsatisfaction to you, and it makes the work even more difficult. And sometimes you feel the need to hire up or to manage up as well. And then when you have a manager who is not socially aware, this is probably my favorite. When you are in an environment that is diverse in regards to socioeconomics, race, ethnicity, gender, non-binary, all of the things, if you do not have a sense of social awareness, that means you can't read the room. You can't read when people are body language are, paying attention or not. You can't read when you're in the room, even Zoom. I truly believe that you can have emotional intelligence even on Zoom. I can choose to lean into the camera while you're speaking, or I could choose to be like this and looking somewhere else while you're trying to report back to me, or doing emails while you're like giving me the report of the day. That is an example of how you can increase one's emotional intelligence. It's called engagement. And then really social awareness brings us down to how well are you taking care of different cultural groups when, this is a Christian conference, so I can't say what I want to say, but when things hit the fan, and societal events happen, George Floyd, Uvalde shooting. When societal events happen that greatly impact cultural groups within your organization, are you socially aware of how they're coming into work or how they're not coming to work? They're here, but they're not really here. So it takes a leader that has high emotional intelligence, a manager that has high emotional intelligence, to be able to gauge and read that, create space if they feel called to do so, to be able to engage in conversation, or to, even if you don't have the answers, to be able to just create space for people to just lament, share if they choose to. It takes someone of high emotional intelligence. If I came in and Uvalde happened, the school shooting in Texas, if I came in and managed my team on a Monday as if everything was normal, we went over our task list, we went over the 20 partners that were working with the country, it didn't say a word, it would negate how people are coming into the room. And I have an emotional, intelligent manager. In 2018 is when I was under J.L. Chambers, and he was my first boss, who was the most highly emotionally intelligent person that I ever worked for. And it was the first time where I was able to email him or email the team and say, Uvalde just happened, and it happened to a Latin community, and I cannot show up at work today. And so I knew that I wouldn't be judged for it. I knew that I wouldn't be seen as a weak person, but I would just be saying, I am processing what's happening right now. And I just need to remove my meetings, I'll push them back, and I'll make sure all my work is done. But they provided me a safe space to be able to process in that way. So are you approachable as a manager? Are you able to read the room as a manager? And are you able to do that as well? And then relationship management, understanding that is the manager able to do conflict resolution? That is key to understanding that there are skill sets to cross-cultural conflict. There are levels to that. And so understanding that to be adept in that is going to be a crucial part of a healthy manager. And then the cultural intelligence is really going over David Livermore's notion of all the 4 quadrants of cultural intelligence, where you are cultural competent in the knowledge, strategy, and action of how, especially, again, I'm going to repeat, if you are new to the community that you're serving into, how culturally competent are you to take care of patients and to manage diverse set of staffs as well. And what we're really calling you to is integration. So these are competencies that we'll make ourselves available at the end of this workshop. We also have a booth downstairs where we have surveys that break these competencies down, where you can add them into job descriptions. You can add them into especially managerial positions, and being able to say that, you know, Alyssa, my culture is not where I want it to be right now, but what we challenge you and want to challenge you in is, can you start hiring for the future culture that you desire to see? Can you start embedding and just integrating competencies such as this that is research-based to be able to say that this is the manager that we're looking for? And we provide interview questions for you to say, has the manager ever been involved in cross-cultural conflict? Not managing it, but in it. And how have they used cultural humility as a lens to be able to not really dominate the conflict, but be able to have a solution as well. And then getting into surveys are going to be your end game. So even if you are a very small, 50-person free and charitable organization, you can start as small as creating surveys that really collect data on staff experience. Qualtrics is a good instrument. SurveyMonkey is a good instrument to be able to start to engage staff experience. And I want to say that 2 things. Self-identification is going to be key in these as well, so you can disaggregate the data based on power dynamics and race and ethnicity identity, but then also rating your managers. So being able to say that, what is the staff experience based on the working relationship with their manager specifically, is where you could start. And that's a simple survey that can be done. And then professional development. If you didn't get a flyer, we would love to give that to you. We created it enough so that it is affordable. We do not believe that quality professional development needs to be for the Microsofts and the Facebooks of the world, but to be able to provide you with resources that are affordable, that we never want finances to be a barrier for these resources. And on this platform, we have designed HR resources. If you do not have an HR office, to be able to use this for interview questions, culturally responsive interview questions, for example, is one resource. And then how do you engage and also measure assessments as well. And so even in the takeaway, wanting to say that we just want you to walk away with understanding the correlation of the patient care quality and what it has to do with managers, and also understanding that all of this is a learning journey, is skills that we can acquire along this as well. And then also being able to say that the integration piece is where we say it goes from an idea to a desire, to conversations within your organization. And when you start to integrate this, it becomes structural. So that even when you are not having the conversation, or if you are the squeaky wheel who's always saying, we have to do this, we have to do that, why aren't we doing this? When it starts to be integrated, it's no longer about one person saying it, but it becomes embedded into the structure of the organization at the same time.
Yes, and introducing EdEnough as well. Like Alyssa said, we wanted people to have access to professional development because we know it costs thousands of dollars just to bring a consultant in just for one session, right? And so how are you going to do that monthly? Because it's just not affordable. So that's why we created the EdEnough platform, and we also created certificates in these key competencies that we talked about today in psychological safety, cultural intelligence, emotional intelligence. And I really love conferences. I feel like I learn a lot of information. I get really energized from people doing the work that I really want to see happen at my own organization. That's how I'm feeling. But once you get back to work, some of that energy dampens down, some of that excitement dampens down, and so that's the reason we created Ed Enough, is because it can be integrated into your onboarding process, into your continuous development process, and it's equitable because every single person, not just managers, not just leaders, but even staff members who are doing patient care, can grow their competencies in cultural intelligence, emotional intelligence, things of that nature. So it can really be built into the day-to-day systems. And we also want to be able to offer you an opportunity to see what it could look like at your own organization. So we have a QR code here, and we'll give you 2 weeks for free if you sign up on the form. And then from there, you can explore every single topic that's on the platform. And if you want to complete a certificate in those 2 weeks, you can go ahead. That's a reward. I like certificates. So. But thank you guys so much for showing up today. We really appreciate you. And Alyssa, anything to add before we get to questions?
No. Another thing is that the next workshop, we have our 4 women who are in who are doing equity work in federally funded and free and charitable, who are doing a panel about the actual work that they are doing in their own context. So if you want to stay for that, that is the next session. And we have one tomorrow at 4 p.m. where we are interviewing CEO Steve Noblet on where is the gospel in DEI, and he's going to use his personal experience, what God has spoken to him on the theological stance. We know that that can also be a bottleneck when we get into equity work with your boards or your C-suite, and so we invite you to engage in that conversation as well. Thank you all for your time, and have a good rest of your evening.